I think we are live already, so I'm glad that I'm checking the YouTube. All right, so good afternoon, everyone. Today is October 15th, 2021. This is our United Medical weekly update for Delaware Health and Community, as well as other people who may be watching this. Today, we have different topics that we are going to discuss. We have our COVID updates, and then we also have a couple other topics that we are going to discuss. And as we are going to start, I'm just going to send the link to our people so that they are aware of it. Right, and then Tanner and Anthony are going to join me later on. All right, so, okay, we started everything here, so we should be good. All right, so what we'll do, let me actually just go through our presentation. And so, as I mentioned, we are going to discuss the COVID numbers, the vaccine updates, and as well as the enrollment in specialist care management, specialist in the care management, and also, I'm so sorry, but several messages are coming for the live stuff. So, okay, I'm going to stop now. I won't check my phone anymore. All right. So there are so many different things that we do, but one of the things that we wanted to discuss today is the specialists in the care management and their role in it and what we expect from United Medical ACO. And Anthony is going to join me. And we're going to also discuss the physician shortage in Delaware and different parts of the United States. So what I would like to do first is to just bring up our COVID numbers. And every once in a while, we are actually bringing these up to you just to see where the cases are. And as many of you know by now that we do present these numbers to our providers, and the idea of presenting this to the public is coming from that meeting. So there are still about 100,000 cases as of 2 days ago in the United States, and yesterday it was about 89,000, almost 90,000 cases. So COVID is still at full speed when we look at here. Now, we also wanted to kind of see how we are doing with the vaccines, and it just brings us to our main point. Like today, when I was checking the news, I see President Biden and him urging businesses and parents to step up on the COVID vaccination. So the issue that we see is the lack of maybe interest at this point, although many of us, we are at the point where we are getting ready to get our booster shots, but there are many people who are not getting their vaccines, who have not received their vaccines yet. Now, so at this point, I'm going to ask Tanner to join me because we are going to go through the vaccine updates so that we can kind of see how we can help President Biden with his message. Perhaps he got his booster shot, I believe, last week,
right?
And then this time he did it in the right place. And so, Tanner, what do you have for us?
And I think I think he's calling on those populations in particular. I know we'll get into it a little bit. And we've talked about some of the mandates that have come down from the federal level, particularly involving some larger businesses. So looking to see that that is still obviously something that's being implemented. We're seeing, of course, that there's some smaller businesses that aren't necessarily going to be affected by that, whether they're not federal contractors or federal employees or have under 100 employees. Those are probably some of the people he's talking to directly there. And similar with the parents, we have discussed kind of the impact on that pediatric population. So that's going to be more and more important as schools are now in full swing. So kind of what we're seeing around here in the United States with our continued coverage of the vaccination rate, we're seeing just under 1 million vaccines doses administered per day. And that rate's kind of leveled out a little bit. You can see on that graph, we haven't really moved above or below a million. We're kind of hovering around that mark here for a while. And that's kept us at that 3-month time period to cover 75% of the population. So continuing to keep an eye on that, but it's been pretty stagnant, I'd say, for the past few weeks. So then,
Tanner, the number for our daily number, the highest one was about 3.3 million at some point, right?
Yeah, correct. Like right in March, towards the end of March, I believe maybe that probably looks like it was closer in the middle of April. We had that hovering around just over that 3 million a day mark. I think at the highest, though, any given day, we got, it looks like right under 5. And I remember some of those weekends there when the vaccine rollout was really starting to kind of come into full swing, started to nail out some of those logistical issues. And we had a lot of those big vaccination centers were what was really kind of pushing that in the beginning.
What's happening with this in Delaware?
Delaware, we are kind of still above that national average. So Delaware is right around that 66.7% mark. No, I actually put that here on my graph, not realizing that it was at the top at the time. But as you can see, we in Delaware are just under 67% population of people covered by the vaccine. So that has...
This is all ages though, right? 66.7 is all ages.
Correct. Yeah, that's all ages. That's not necessarily any particular demographic population there. That's just our population for people here in Delaware and regardless of eligibility of the vaccine. Which is a good number. That means we're hovering right around 2/3 of people in the state.
So now, do you see us from your point now? I mean, I have my own opinion on this one, but for us to be able to get to a certain point in this, like that 75%, that 3 months, 4 months, 5 months, it always just changes. Do you think we are going to really get to that in 3 months?
In 3 months, I doubt it. Like you mentioned, I know that there are a lot of populations that are starting to become eligible for booster shots, but we're still seeing that same population kind of that has not now been or has been yet to get vaccinated, kind of sharing some of the same hesitancies and hesitant behavior. So I think it's going to be difficult, especially how we've seen that 3-month continue to get pushed back. And we're starting to see, as we do kind of get into the flu season, there's been a little bit of an uptick. Those graphs kind of showed that as well. I think people are starting to have some of those other pressures from whether a social setting, a family setting with the holidays coming up, things like that are going to be now more important in that decision making. But I think it's kind of been a slow go for quite some time now. So,
all right. So now I think part of the issue that I see, I think the media, like the way that media actually is covering these news, I guess. So like there's one that I think you picked, this one is the COVID cases dropping in North and South America, how the agency says. We are laughing this because I think we were not agreeing with the way that it was written, right?
Right. I think they probably could have done a little better.
No, that's not yours. That's Reuters, right? So
no, yeah, that's not me. But yeah, I thought this was interesting. This was an article I was actually reading this morning that kind of, I had started to talk a little bit about hotspots. We were seeing how cases have matched up with vaccination rates across the country. And really what this report came out and said was that's a pattern that, of course, as I'm sure you can imagine, we're seeing across not just our country, but really in the world, and particularly focusing on our hemisphere, so North and South America. Overall cases are dropping, which is a great sign. In those hotspots that we kind of touched on last week, but right now in the United States, we see that in the American Midwest. That was a big one, as well as they have Alaska and Canada as Northwest territories as being hotspots right now, which is interesting. Those are where we're seeing some high infection rates, but all in all, we're seeing a decline in cases across the continent. Now, what was really the important takeaway from here, I think, was the best way, of course, to combat some of those hotspots and some of those increasing and rising infection areas is with increased vaccination, which is what we've been talking about for a while now. So until we can kind of see that an equitable exchange of vaccine and making sure that the access to vaccine is there in some of those underserved populations, I think is when we'll really start to make progress towards that 75% mark as a whole.
Sure. I think, again, like going back to the way that media is covering this is one thing, but then also the disagreements that federal and state governments may have, which we are seeing now in Texas,
Right.
is another problem that I see with the vaccination rate. So now this issue involves the employers in Texas, and I don't really feel strongly about the mandate because I believe that people should be able to make that decision. But now what's happening in Texas is kind of concerning. So we also wanted to kind of discuss this. So again, there's so many different sources giving us different maybe perspective. And it is confusing because now here, when President Biden wants everyone to get vaccinated and mandates, then there's Texas who's saying that they're not going to follow the Texas governor, right? Didn't want to follow the federal mandate. So what's the real story here?
Yeah, and that's exactly right. I think it's just creating a lot of confusion and uncertainty. It really plays into the reception of the vaccine for the population, particularly the population that is unvaccinated. So on one hand, like you're mentioning, we're seeing a federal mandate come down for federal employees, for employers with 100 or more employees, and in certain other kinds of occupational settings. And then on the other hand, and now, like you mentioned in Texas, we're starting to see, or we already did see Governor Abbott come out and mention that there was going to be a mandate essentially saying that there is a ban on the vaccine mandate so that they can't be in any sort of entity in the state. They're not going to be able to enforce those, which goes directly in contradiction to the federal mandate.
So I guess what's going to happen with these controversies is that here, like Mark Cuban, I thought he owned Dell. Apparently, he didn't. We were just discussing earlier. So now this guy is he's in Texas, right?
Correct. Yeah.
So, and he's saying that he's not gonna.
He's saying that he's not going to. He's going to side with the federal mandate, and as well as a handful of other large employers in the state have already come out kind of in support of that same behavior as well. Like a few of the airlines, I believe Delta, American, they're headquartered in Texas. They're going to side more on that federal mandate, and it's created.
Yeah, I think the federal
tough situation.
Federal government would supersede. But now I know Anthony is with us, and although I didn't ask him what his position on this one, but Anthony, feel free if you want to join us on this. I'll wait for a couple. Okay, there. Yeah. So I don't want to put you on the spot, Anthony, but like this is kind of like it's happening in the last couple of days. So now the conflict, I guess, between the state and the federal government is going to create some anxiety between those people who want to get vaccinated, but also it involves us with the employers, right? So what's the right thing to do, who they are going to follow? Do you have any different maybe perspective on this?
Not really, although it's clear this created some confusions. And actually in Texas, you have some former hospital employees who were let go as a result of the mandate, going back to court on the basis of the Texas governor's decisions to now ask to have their jobs back. So it's that creates an additional layer of confusion on top of what's already existing. But I think that in most cases, this probably will be resolved on the side of the federal mandates. The responsibility of Office of Safety and Health, OSHA, it's very clear in terms of its role with regard to workplace safety, workplace health and safety. It's a long established process, and I'm not convinced that a state mandate will supersede that which has already been in place for more than almost 40 years now, I think, because it goes back to the Nixon administration.
It may be just me, guys. So when I look at this picture, now, this is the guy who wants to follow the vaccine mandate. Now, although when I say I don't have a strong position on the mandate, but I do believe that people should be vaccinated 100%. There's no question. All of my family, as I mentioned in the other sessions, they're all vaccinated. But I cannot force people to get vaccinated if they don't want to do it. But I think the way that media covers these things, I have a little bit problem with the images that they pick. Like this, here's this guy who wants to follow the federal government. But I think I don't know. Is it just me that this picture is kind of like almost not promoting who wants to go through with the vaccine mandate, or is it just like I'm being too sensitive?
Well, I kind of see what you're saying, Kemal. I think in certainly the way that this is portrayed, especially in some of the big headlines, it's difficult because it makes it really kind of it's very stark difference, right? So it's either you're following it and you're kind of in this on the side of erring caution, or you're on the side of absolutely completely against it in all terms of the way. And it kind of seems like it's a vilification of the other side, which can certainly cause confusion, but it also can help not create a lot of public support, I think.
Yeah, when I see Mark Cuban's picture, it's almost like he's urging people not to get vaccinated. Like, oh, here's the rich guy who wants you to get vaccinated, kind of like he's sitting so relaxed, and then like you see what I mean? Like,
I think it's the grin for me.
So now, again, speaking of how media is covering this, and last week we discussed the Bill Gates 2010 video, and this time we have every week there's something else coming out, and they are making some acquisitions around our favorite Italian, Anthony Fauci, Dr. Fauci. So, Tanner, you did prep some stuff on this one. Tell us what's going on here.
Oh, yeah. So there seems to be some pretty similar to the video that we looked at last week with Bill Gates, right? So there's a video from a health conference just a few years ago. I believe it was in 2018. That there's a snippet of it from part of a conversation where the National Health Institute is looking into, and has been for quite some time now, doing some trials on a universal flu vaccine. So it pretty much is exactly how it sounds, right? So each year we have to develop a new vaccine for the flu to help combat that year's dominant strain of the flu. But the idea is there should be a robust version of the vaccine that once it's taken, it can help combat the flu in any types of form or strains that it takes on. So it comes down back to actually mRNA vaccines, which are what the Pfizer and Moderna vaccines are. So that technology has been researched for quite some time now. And there was recently, again in 2018, a health conference or health discussion where Dr. Fauci was speaking on the benefits of what such a vaccine would do for society kind of moving forward. And he, I think, mentioned something along the lines of a new or some sort of robust vaccine to combat the flu would be a great tool to help fight it and reduce the amount of course, inoculations like that annual come back and get a flu shot.
So now, Tanner, you and I, we are two different generations, right? Mm-hmm. So your generation's X or Z, you are Z, right? I'm X.
I think, yeah, that's correct.
So, and then we have millennials in between. So now with the trust issues around the government, like your generation, do you guys feel differently? I mean, of course, it's not just one, unified or united group, but like, what's the overall take on what government does in these things? Like, do you not trust, although you are all vaccinated, right?
Yeah, correct. So, yeah, I don't think it's necessarily a thing of distrust. I think that it's more along the lines of trying to find and hold people in those positions as accountable as possible. And it's tough because when you do see And in addition to kind of what comes, I think, with some of these younger generations is that's digital age, where we've talked about how difficult or how easy it is rather to take one thing and spread it very rapidly. It's really put some sort of spin on it, which that side of information certainly is dangerous. And just from, I guess, my personal experience, I don't think it's necessarily distrust, but it's just making sure that everything is verified, people are held accountable, and you're making sure that you're getting the most informed information. And that's how I try to go forward into situations like this and just make sure that I'm not getting some sort of spinned story.
That's. I think your personal position is good. I think there's maybe on the generational side of it, there's some disconnect that always happens to you, by the way.
I know. I got to make sure I get into it.
So the issue of us not maybe trusting fully, and again, in some generations, this is more a problem than others. But I think vaccine so far, when you look at the history of medicine, vaccine only improved our quality of health and save the kids. And I haven't seen any disadvantage. I'm sure there are some maybe cases but if it's under 1%, the benefit that you are getting is always bigger than the disadvantages. So then I think people should be more careful with their decisions. Again, the mandate is one thing, but when people understand what this has to be and how it needs to be done, and understand that this is not some political decision, because President Trump wanted everyone to get vaccinated, and President Biden gives the same message. Like sometimes the problem is they didn't give the same message at the same time, so there was an overlap maybe, and that's why sometimes but these politicians, the politics of this is the confusing piece. But when you look at this, the medicine side of it, and if you do trust your primary care physician, your specialist, then you need to follow what they say. All of our doctors are vaccinated, and it's not even an option not to be vaccinated. So my take is, and I'm about to get my booster shot in these days now that are qualified from the health worker standpoint. And I always tell people, my family, they're all vaccinated. Most of my friends are vaccinated. Just we want everyone to be safe, not necessarily we want to put something in anyone's body. But, again, we do understand where people, sometimes there are strong positions in some cases, and I don't necessarily feel like that's my job to change their mind.
Come on, I think I lost your audio. Can you hear me?
I can hear you. You're not able to hear me?
I can't hear you.
Let me ask.
Anthony. It might be me.
Okay.
I think I lost internet.
Okay. Anthony, you're able to hear me then?
Yeah, I can hear you.
Come on, I think I lost your audio.
I think Tanner had maybe an issue with his connection. Are you good, Tanner, now? Well, actually, I was just about to call Anthony in for our next topic. So while we are speaking of making these decisions and people who are actually helping us to be healthier, what we also want to make sure, which is all kind of involved all together, like there is a shortage of physician. This is a reality. And if you guys remember in the last couple of sessions, what I was discussing is like if we lose any physicians because of the unvaccinated population, then there's also this physician shortage, which can be even greater. Or if the stress that they have is so much, then they may not want to be in it, or they may retire earlier. So when I was going through with these, and Anthony and I, we always talk on different topics, not necessarily we are always on the same page. We don't always agree on everything, but we always have high intellectual level discussions around these. So we wanted to discuss this physician shortage issue, and just to kind of see where we are, especially in Delaware and around the United States. So Anthony, I'll let you go through this for us.
Yes, thank you for having me. I believe it was in 2018, while Dr. Walker was still the secretary here. The Department of Health and Social Services did conduct a study. Can you hear me?
A little bit, if the mic can be a little bit closer, it's better.
Okay. Yeah. So the study did identify clearly a PCP shortage issue in Delaware, especially as you move away from Newcastle County. Not that the situation was necessarily significantly better in Newcastle, but overall, it did identify shortages in the state of Delaware, especially on the primary care side, and both in terms of actual numbers and in terms of the median age of practicing PCPs in the state, which is what gives you an indication of who's closer to retirement versus who's either at the early or mid stage of their careers. And it did, in addition, identify shortages when you filter for race and ethnicity, severe shortages of primary care physicians of color, for instance, which all builds into the related issues of social determinants of health. So it is a serious problem, and it is what in turn led to the legislation that then followed this study. I'm referring to the primary care bill, which is looking at how using the reimbursement system to increase interest in primary care, increase the number of primary care physicians who might be interested in coming to practice in the state of Delaware. So from that broad perspective, it's a serious problem, and is especially the case in Kent County as we speak. Looking at it from a comparative perspective, slightly better in Newcastle than Sussex, but especially challenging in Kent County. Right.
So, Anthony, one of the maybe first articles that I wrote was about physician shortage. So it was maybe, I want to say 2008, perhaps, like when I started that writing process of the articles. I think it was one of them, and I should have looked at it before. Maybe Tanner can look at it and let us know on my blog. But I think it was physician shortage and electricity. It was titled, if I'm not mistaken. So the problem is, one is like, many people don't know that Delaware already is under the J1 Conrad program, which means, well, actually, again, everything that we say is based on what real stories. So like, I didn't know, for example, that we have to prove when we hire someone who's graduated from a foreign country in medical school in residency, so they have to do service for 3 years in the undesirable areas. And this is the term undesirable is on the
underserved.
Yeah, so it's like underserved but undesirable. So you have to prove that the place is undesirable. So we just finished actually the site application. One of my executive assistant and Wilson actually just got 4 site applications, site approvals for our cardiology practice. So you have to prove that this place needs more doctors. So in order to do that, you have to show the place as undesirable, which is underserved, But in order to qualify for the underserved, you have to make sure that it is undesirable. This is like it's kind of with the sensitive politics that we have these days. It doesn't sound good, but that's how it was.
Yeah.
So now, but I think the bigger issue is one of my first projects in healthcare was getting the J1 application for one of our cardiologists. So, and many people that I work now, they were probably 3-4 years old when I was doing that. And it was the shortage of physicians in cardiology. Then it was only for Milford location down in Sussex County. So then it got up to Kent County. And then we had primary care physicians in the middle of Newcastle County, right in Wilmington. In fact, United Medical Clinic had J1 physicians, and Middletown is J1. J1 means that these are underserved areas. So the reality of it is there's a big physician shortage. Everyone knows about it, but no one is actually really understanding how bad the situation is until probably it's going to really become a crisis. So that's I'm kind of worried about it. But as you mentioned, this is the biggest gap is in the Kent County.
Yes.
That's the case, right?
Yes. I tend to look at this from two broad perspectives. One is, as we've been discussing here, is the issue of the numbers, the hard numbers, and the survey in 2018 by DHS highlighted clearly the gaps where the numbers are short, and it gave all those details. But there's also a different way of looking at it in terms of the care management part of it, the care management. I don't know if you recall, a couple of years ago, you and I were in a meeting where there was a debate about including one of our specialists in a board. Mm-hmm. And one of the counter arguments that was put forward was that, specialists are generally known for providing expensive care, and therefore it wasn't appropriate to involve the specialist in the board, which in my view tends to reflect the fee-for-service old world perspective of this versus the value-based perspective of it, where about up until 2010, Medicare used to reimburse higher where there was a specialist consult. And after 2010, they stopped it, and most commercial insurances adopted the same policy. But today, the issue really is related to the shortage of primary care, is the issue of management of patients. The CDC data shows that 6 in 10 US adults has one chronic condition, and about 4 in 6, I believe, should have like 2 or more conditions. This is the CDC data shows that. And within the value-based space, especially with regard to Medicare shared savings, you see our patient population will show roughly about 3.5 conditions per member within our panel, right? And what this immediately suggests is that while on the one hand we have shortage of primary care physicians, right? The care management of these members transcends now the fee-for-service approach where it was based on referral. And a transition to a value-based perspective of this is one where we see this as a co-management issue rather than simply a specialist referral. And if it is a co-management issue, then the stress on the primary care physician lessens because the burden is shared between primary care and specialists. And in this case, I make a distinction between the surgical specialist and the medical specialist, who you will expect will be involved in the management of a patient with chronic condition pretty much for the rest of their lifetime. So through a looking at this from that specialist perspective, there is a new role now in this where we are challenged to increasingly look at an expanded role for our specialists. For those who are familiar with the Medicare shared savings, the typical ACO is usually either hospital-based ACO or ACOs formed by medical groups such as ours. Within that category of ACOs that are formed by medical groups, you have those who tend to have narrow networks of, say, only primary care physicians. One of the ACOs in our state here only has primary care physicians. But in our case, we have a multi-specialty approach. And if you examine the cost, the total cost of care on an annual basis for each ACO, about 55% of ACO's cost happens outside of an ACO's network, typically, right? But in our case, with a multi-specialty network, with a focus on co-management of the patient and a balance between primary care and specialists, you find that leakage that you would normally have in a standard ACO of 55 or more percent, that leakage is less within our group. Not just, and we don't speak here just simply in terms of numbers of leakages. We also speak in terms of improved quality of care, improved information flow between the specialist practice and the primary care practice, because we're all within a single domain. So in the long term, what we are essentially exemplifying through a multi-specialty approach is, I would think, a more balanced approach to the overall management of the patient, the overall execution of an ACO program, and in my view, a more sustainable approach to this, especially as more and more of the hospital ACOs work hard to capture the private practices and move them within their own groups.
Anthony, I think the way that we are approaching this, and I'm actually just looking for one of our images that we had used. I don't know if Tanner is able to maybe just find that. The one that I'm looking for is the flow between the PCP and specialists, and from our approach standpoint. Now, I think, and then just let me know if we are maybe we are looking from the same perspective on this. So what we are explaining is there's the physician shortage, then especially on the primary care side, because many of the people who are going through the residency, they don't stay in family or internal medicine, and they go for another specialty, other specialties. Or if they stay in the, if they don't go for specialty, they may actually go for hospitalist jobs.
Yes.
So that's one. The second thing is, and I'm not trying to be politically correct, and it is our opinions at the end of the day. But I think the other maybe issue that we are struggling with is and we have a lot of PCPs, and I own a primary care office, but I think there's a little bit pushback from the primary care, how they are maybe accepting the specialist in the clinically integrated setups. Although they do work together, but when we are making these very kind of structural, and there are some protocols in place. So we have a little bit pushback from the PCP side of it. But then I think another thing that you mentioned is the way that maybe even CMS is emphasizing certain things. Yes, we want PCP focus, and PCP is in the center, but we are not crossing out the specialists. So then many ACOs, many MSSPs are exclusive for PCPs, and we didn't make that mistake from the beginning, because we do believe that this is a full clinical integration, multidisciplinary approach. So it's not just one managing everything that patient has, but more about the co-management of how that should be approached.
Especially when we're dealing with the fact of patients with multiple conditions, and therefore would require that team-based approach.
So I do want to add one other thing to this, because there's this what we are trying to do from the ACO side, and Anthony and I are both on non-physicians, and we are not physicians. So, but we work in the clinical setting with physicians. And one of the other things that when we have our care coordination, our care managers, our nurses, when they start getting part of the management of these patients, we still have a little bit pushback from our physicians. Yeah. And this is not just for us, but this is kind of like universal issue. So I guess our role, our maybe job here is to really lead and guide what needs to happen. In some cases, when we are a couple of steps ahead of the game, we do have a little bit disagreements, but the thing is we are actually seeing what's coming, and then we want to make sure that we do the right thing for right reasons. And so this whole approach of understanding the physician shortage is one thing, understanding what co-management with the specialists is another thing, and accepting the care management team in this, which we are actually advocating for private practices. But this doesn't mean that we don't have a stronger structure than hospital systems have. So that's what we are pushing for. And that's that's kind of our goal. And we don't want to compromise in any way that quality should be in question. So, but like, it's not just one topic that you can just say, oh, well, you can do this and then you'll be fine. It's not. It's like there's so many things that are involved, and you have to have a really good understanding of what's happening. Anthony, thank you for bringing this up. So, and thank you for being part of this event. So it does help us when we hear this from different people in the team. Thank you for that again. So now we are about to finish our session. So what we have, like from this week, couple updates. As we mentioned last week, we had the YWCA annual breakfast yesterday. Our United Medical Leadership team was there. We met the CEO of YWCA, Stephanie, and also our state senator, Sarah McBride, was also there as the co-chair of the event. But our leadership team, they were there. Tanner, this year we did the first time the watch party, right? Because it's now on the pandemic with the limitation with the in-person events. So,
yeah, correct. We were able to get a good amount of people together here at the office. So for those who were unable to attend in person, I know in the past they've done the large breakfast all together to be able to hear the speakers and see the presentation. But we were lucky to get a good group together here and utilize our conference and our boardroom to still be able to watch and participate, which was a lot of fun. It was a good time.
Excellent. And then tomorrow, as you guys know by now, that part of the advisor board for Brandywine Valley SPCA, tomorrow there's an event in Rehoboth for Bark on the Boards from 10 a.m. to 1 p.m. If you are free and you are down at the beach, please feel free to join Brand 1 SPCA, and hopefully it will be a fun event with good turnout. Now, again, this weekly event is happening with the help from Tanner a lot, but today is Tanner's last day at United Medical. He's moving on with his, kind of with his life, and therefore his job goes with it. So he's going to most likely, is not most likely, are going to be relocated down.
Correct. Yeah.
But you're still in healthcare, right?
Yes, that's correct. Still in healthcare. I'll just be making a jump from the Newark, Delaware area down to Washington, D.C.
Excellent. So, well, I do want to also thank Tanner for his efforts, his help, making this event more smooth and almost flawless. So, again, thank you for that, Tanner. So, and we'll continue doing these on a weekly basis. Today, we have another event in 13 minutes with Dr. Erkan, our Bariatric Friday, and we'll be back next week with the updates from United Medical ACO. Thank you for joining us, and